With Christmas around the corner and cases of COVID rising around the country, it can be a challenging time to manage differences in expectation between vaccinated and non-vaccinated family and friends.
So how best can we manage these social situations, and what are the health considerations we should be thinking of right now? Let's bring in our panel. We're joined today by Professor Catherine Bennett, the Chair of Epidemiology at Deakin University, and Dr Susanne Schweizer, who is a lecturer and research fellow in the School of Psychology at UNSW. Welcome to you both. I'm going to begin with you, Susanne. This Christmas might be the first opportunity some families have had to reunite in months, if not years. Does it stand to reason that there may be some unusual tensions around the Christmas table this year?
Yes, absolutely. I mean, especially in the context of what you've been talking about, vaccinated versus unvaccinated. There may be quite a bit of anxieties around that. And so we also have this new variant, which is, of course, again, causing uncertainty around the health implications of the new variant. And so we may feel really uncertain. And so that is, we know that that can cause anxiety for especially some people who have troubles with tolerating these high levels of uncertainty. So it can indeed, it may be, causing a whole range of emotions, and some of them negative ones as well, as of course being very, very happy to be reunited with our families and friends around the Christmas tree.
Susanne, do you have any advice for managing those tricky conversations, particularly with members of the family that perhaps don't want to get vaccinated for whatever reason? How do we include them if we do? How do you have those conversations?
I think it's really important to have honest conversations. So what we want to do is we want to think about, what are our motivations for the way we're feeling. So we may feel, it may be actually anger that we feel towards the unvaccinated family members or friends because they are putting our family at risk. But that's an easy emotion, it's a quick emotion, anger, and we may want to interrogate that and see what actually lies behind that. And it could be simply a sense of anxiety again, but it could also be a sense of loss, of being upset of maybe if they can't join because they're unvaccinated and we have an elderly parent or a child that's at risk due to health vulnerabilities. And so I think it's really, really important to be open about these motivations and to be aware that the other person, the unvaccinated person, they will be having a whole range of these same feelings, because it can be really confronting to our sense also of self-identity. If someone in a very close-knit, in a very tight group, a family group in this case, has a different, all of a sudden is taking a different attitude, a different stance on something so crucial, really a matter of arguably life or death in this case.
Well, Catherine Bennett, let's bring you in. Let's talk about the reality of the risks of Christmas dinner. If everyone in the room or the veranda, as the case may be, is vaccinated, and then again, if there are people in the group who aren't.
Well, it actually depends where you are in Australia now. In Victoria, we have here a Delta outbreak still ostensibly. We do have Omicron spreading through the community as well. A lot of the population is actually not only fully vaccinated, more than 92% of those 16 and older, but they've been fully vaccinated quite recently, or the very early ones are starting to get their boosters. So the risk of actually having an infection is much lower. It might be as low as a quarter if you've been fully vaccinated, but it's not zero, so that's important to remember. But we've also got Omicron now circulating here, but we've also seen that across other states as well. So with Omicron, people who are more than 3 months out, or more than 2 months out potentially, start to really see waning protection if they've had Pfizer against the spread of the variant. If they've had AstraZeneca, then they have much less protection against any infection, so any symptomatic infection. The vaccines still prevent well, not completely, but very well, that serious illness in people who are fully vaccinated, but that really steps up along with the protection against any infection once you've had your booster. So it depends where people are in their vaccine course, depends which state you're in, which variants are likely to be there and what that background risk of infection is. in the first place. So it does vary, but no one has zero risk, and that's an important point here. If you've got someone really vulnerable at home, then whether you're vaccinated or not, you might want to firstly check, if you're having people to your home, do a rapid antigen check. It's not a complete guarantee you haven't got the virus, but a negative test on the day or the night before is actually another safety measure you can put in place, just to make sure there's no obvious sign someone has either very infectious period without symptoms or some mild symptoms they might have. You shouldn't really have people to the house. But you might also ask your visitors, and that way you're not saying you need to do it because you're not vaccinated. You're actually asking everyone to actually, if they wouldn't mind doing this, because you do have people that are part of that family gathering that probably couldn't meet last Christmas, that you do want to bring together. So I think it's about recognising even unvaccinated people aren't necessarily doing it because they don't think Omicron's a problem or that coronavirus generally is a problem. They might have their own reasons for not being vaccinated, but they might fully understand what risk is and how best to manage it, and be happy to be part of something the whole family's doing to both get together and make that a safe event.
But do you think it's safe, Catherine Bennett, to have that member of the family at an event that may include older members of your family? Should they be there? And in medical terms, how much danger does that add to Christmas lunch?
Well, if we're talking about Omicron being the rising risk, and certainly that's what we're seeing in New South Wales at the moment, it actually won't make a big difference if they're someone who has had Pfizer recently and they're full course, then they will be at reduced risk of having the virus. But again, it's not zero. But if it's someone who's had AstraZeneca recently, or 3 months ago and not yet ready for their booster, they will be not at a dissimilar risk to being infected as an unvaccinated person. They're more protected against serious illness. That's the key thing. That still holds up with vaccines, but not in terms of having an infection which could have you infectious for other people. And we've seen that in the recent outbreaks, young, fit, healthy people, probably recently vaccinated, out at events, and really high attack rates, as we call them, with lots of people infected. So the most important thing is to try and make sure you don't have anyone who's positive there. It's less likely a vaccinated person will be positive, particularly, or will be infectious if they have had a recent completion of their first course. But it's as I said, it's still not zero. So if there is someone who is vulnerable, then you do need to think about how you balance that risk. And I think asking everyone to use a rapid antigen test isn't a bad idea in that setting. On top of all the other things, really good ventilation, having the event outdoors if you possibly can, all of those things, as well as asking, everybody not to come if they've got any symptoms, for example, they're the things that will just help keep it safe. And the final thing is, the less people do in the lead up to a gathering, the less likely they are to get a last-minute exposure that could, in fact, make them infectious. With Omicron, your speed from exposure to actually becoming infectious and developing an infection yourself is very short. But actually trying to prioritise a family gathering and doing less in the lead-up will make it safer going to that event for everybody, whether you're vaccinated or not. So I think that's sort of what we're starting to see. A lot of things are quietening down at the moment as people don't want to either be in isolation because they've got the virus themselves, or to not run the risk that they might be infectious when they're moving around with family and friends at New Year or Christmas or wherever.
Susanne, Catherine just outlined a number of ways to make Christmas Day safer, mentioning that everyone could take a rapid antigen test before they arrive, make sure that the room is properly ventilated, or better still, move the event outdoors. How do you suggest that these topics should be broached with family members to ease any discomfort?
So I think it's helpful if we approach them with everybody, so that the unvaccinated person doesn't necessarily feel like they're excluded. I think it's important to talk about your perspective So to say that this is, that you are worried about and that you appreciate it, it's not necessarily rational, or that you know that the data is not clear yet. So just to acknowledge those uncertainties, but also to really acknowledge and be honest about how you feel about these things. And as well as if you communicate it to everybody, then it singles them out to a lesser extent. And I think that will be helpful in terms of the dynamics of the group if you are getting together.
Catherine Bennett, these events are going ahead all over the country. The timing with Omicron rising at the moment is not great. What do you expect we will see post-Christmas? Are we going to see a surge in cases due to these Christmas gatherings? And are we at risk of putting our loved ones in danger?
Well, I think we've started to see that already. I think actually some of the larger functions that have been happening, end-of-year functions for work, larger group gatherings, people coming together who've started the travel season, all of those things have actually been helping to lift numbers. In Victoria, our ICU numbers had doubled, more than doubled, before Omicron was an issue in the state or even in the country for that matter. So we know that those case numbers have been pushing up, even though you don't see it in the daily counts necessarily. So that time of mixing has already begun. We're already seeing some of the aftermath of that. Put Omicron in the mix and that could lead to more rapid spread. So we will continue to see cases rise. What we're seeing in South Africa gives us hope that these waves might burn themselves out quite quickly. We have a rapid rollout now of an accelerated booster program with those people who were due at 6 months now brought forward to 5 months. So there are a number of things happening that will help combat this and hopefully turn it around. But I do expect right up to New Year, where you've still got these gatherings happening until we really get into that school break. School's not happening. People are holidaying and together, but not in very large groups. I think things will settle then. So
Catherine,
hopefully they won't continue.
Just finally and briefly, we've been learning overnight of restrictions coming back into place across the UK and various countries in Europe. New Year's, Christmas celebrations curtailed, fireworks events cancelled. Do you think we could be in that position before the end of the year? New South Wales cases are rising quite quickly, and the Premier and Health Minister in this state are going to be hopping up later this morning for an update. Do you think they're going to be forced to impose some more restrictions or bring back the mask mandate within the next week to fortnight?
Well, it will depend on a few things. They're watching literally day by day what's happening with hospitalisations to see if these rising case numbers is really going to impact in a way on the hospital end. The hospital numbers will dictate what's necessary in terms of disease control. The masks, again, it depends how many people are actually doing it anyway. If people aren't doing it because it's not a rule, then they may have to bring back in a rule to get them to do it. But I do think, they're the things we all know works now, and that's the sort of thing that we can each do that helps minimise risk. A rule doesn't mean that you don't have to do it if the rule's not in place. I think people are now aware that actually if we do these things, we don't necessarily need the rules. But if that's not happening, you have to get the rules in place. So they'll be monitoring it closely. New Year, I think, is a challenge to hold those very big events. They are tending to be outdoors, though. We have outdoor fireworks, a bit different to some of the international events. And overseas, they had a very large wave emerging of Delta even before Omicron came into the mix. So we're not in the same position as the other countries at this stage, but we have to see what happens over these next important couple of weeks with Christmas and the lead up to New Year.
Yeah, let's hope that holds out. Catherine Bennett, Susanne Schweizer, great to talk to you. Some tricky conversations and situations ahead of us. Thank you.
Thank you.
Thank you.